I know, so we were saying that campus feels like it did kind of before COVID. COVID hit only 7 months after you
That's right.
started as chancellor.
That's right.
Take me back for a second to those days before we were sent home. You were in meetings all the time
Right.
talking about this virus none of us knew about,
Right.
completely
Exactly.
new. What was it like for you to have to take on all of that totally unexpectedly and so short after you, not long after you started as chancellor?
So the thing that every chancellor, even if you'd been in this role for a long time, nobody knew what this was. We were calling it coronavirus at the time, and people didn't. The information was coming quickly, but it was incomplete. It was inadequate. The first decisions we had to make that I remember are we had students studying abroad,
Mm-hmm.
and we began to get the feeling that they could get trapped inside those countries if the country shut down. One of the first things that happened was people can't travel.
Mm-hmm.
So a first really hard decision that we had to make was calling our students home from those programs.
Mm-hmm.
And I think we had over 300 students studying in Europe, various places. It turned out to be a really good thing that we did because very shortly after they came back, other countries were doing the same thing. But a decision like that now seems like not a big one.
Yeah.
But at the time it meant they had spent a lot of money to go overseas to spend a semester, usually.
Mm-hmm.
How are we going to get them back? We immediately said, we'll pay for them to come back, but then are they going to get the credit for the course? I mean, it was a complicated set of decisions just to make that one decision.
Mm-hmm.
So those were the early decisions. And then when we realized that you weren't coming back from student break, like really weren't coming back, just the logistical issues about if you lived in the dorm, all your things were here.
Mm-hmm.
Yours were, weren't you?
Yeah.
Because you were in that freshman class. What dorm were you in?
I was in Hess, and I
Okay.
remember coming back in May to get all
Yes.
my things because we had left in such a hurry.
That's right, and we scheduled it. You're coming back to you
Mhm.
couldn't be in there with. At that point, we were waiting for our first case, like a UTK case, and once that happened, and I think it was later in May, maybe in June, we had to shut down the opportunity to come get your things out because at that point, we were spraying down the rooms. We were, it was just the early
Mhm.
stages were a lot of decisions based on the best information that you had.
Mm-hmm.
And then as we got rolling, we made the decision we wanted you guys to come back in August. And we were out there early to do that. And I'm so glad we did.
Mm-hmm.
Even though for the students who came back, the freshmen that came in the dorms, it was mostly Zoom. They were here and they were together.
Mm-hmm.
So there were a lot of decisions, like we bought those hammock stands.
All right.
Those were really popular. And it was all about getting everybody outside. Like,
Mhm.
don't stay in your room. Get outside where it's safer. It's just so many decisions. But I feel like we had a great team. And honestly, we got some recognition for how
Mhm.
well we handled it. I didn't even know there were people rating you on that. We were just day to day trying to get through it.
Mm-hmm.
But I'm proud of our efforts.
Right. And I know there were times during the pandemic when decisions were made not by you, but by state government and
True.
by the courts. And some of those decisions, it kind of fell back on you to answer for those. So specifically, I'm thinking about mask mandates, and that was about court injunctions, that was about decisions happening in the state legislature. What was it
Right.
like to have those decisions you were sort of at the mercy of some larger political forces?
And that was really into the second year of it.
Right.
The first year, I would say you're on the right path, though, because the first year, as a system, we tried to make a lot of the decisions together. So the UT system.
Mm-hmm.
So all of the campuses, we made the decision to come back or not come back. And how are we going to treat masks early
Mhm.
on before there was a mask mandate? Are we going to require masks in what buildings and under what situations? So the first kind of group decision was as a system.
Mm-hmm.
And then you're right that in the second year, there were a lot of other factors that came into it. And once the state had passed the law about no mask mandates, now remember at that time, we were trying to get kids vaccinated.
Right.
So there were like two things going on at the same time, trying to get the vaccination rate up as much as we could. Not requiring it, but encouraging people. So yeah, there were a lot of moving parts outside our own control. And there was a period in there, if you remember, where we had a mandate, no masks. So we dropped the mask mandate. And then it was like within a few days' time, there was a federal issue about if we were going to receive certain amount of money from the federal government, then we had to follow what they said. So I put the mask mandate. It was just, it was in, it was not
Right.
in, and that was maybe one of the hardest times right in there. Was trying to do what was best for the campus, but there were outside forces that were sometimes in competition with each other. So just trying to make the best decisions we could.
Yeah, and I know there were, during some of the days of the pandemic, there was criticism about things concerning like hazard pay, safety for staff, safety for faculty, and faculty mental health during the pandemic. How were you considering your role as a role of support for faculty and staff throughout the pandemic?
Right. At the beginning, we set out 3 values we wanted people to use to make decisions. Be flexible, be creative, and be compassionate. Because we couldn't think of a rule for every situation. So if you're going to decide what classes are going to be Zoom, what aren't, take into consideration a faculty member may be living with someone who's compromised. Be flexible, be creative, be compassionate. And so in some ways that might seem confusing, but actually I think it did give people a lot of guidance and some freedom to figure out what was best in their situation. So that was the beginning of it, was like, we're going to go by those values. And we also said we have really important goals. We're going to keep people healthy and hopeful. The healthy part was easier than the hopeful part.
Yeah.
And some parts of it, because there was a point where it felt like, is this ever going to end? And am I ever going to get back to a normal life? I don't know if you remember it, but I do. So keep people healthy and hopeful, and keep students on track to graduation.
Right.
So, for example, in that first year, we had to do things like those students that were in programs that required study abroad, we had to just say they've met the requirement.
Yeah.
Or figure out something else. They can't study abroad. So something else. So I really hand it to our faculty and staff who helped us figure that out. There was a lot of figuring it out on the fly. And every university was doing it.
So you kind of set yourself apart as a very energetic leader, and you talk about energy a lot. How did you avoid burnout during the pandemic? Because I think people looked at college administrators, and maybe specifically college chancellors and presidents, and thought, that must be the worst job in the world right now. So of all jobs, I don't want that one. How did you keep from...
So during the pandemic, I got better about, in that early part where we were at home. And remember, we were only closed for March, April, May of that first year. But, and I mostly came back to work by July. But in those early months, I got more intentional about walking, getting outside. And I was able to continue to play golf, which was great. I'm not a great golfer. It's a very frustrating game, but I wasn't thinking about testing and housing and quarantine space and all that. It was sort of a break. But I think it was hard on everyone. Honestly, it was easier for me than a lot of people. I did not have young children at home that I was trying to school them and do my job. So I think it was a lot easier for me than a lot of people. Many of our faculty and staff had to deal with all of that. And honestly, I don't know how I would have done that. If I would do drop-in Zoom meetings with staff, for example, or I'd attend a departmental meeting by Zoom. And I would see them there at the kitchen table, and you could see their kids were running around, and like cats dropping you down on the table. And I was like, I could not deal with that confusion, all that responsibility. So honestly, I consider myself blessed. My kids were adults dealing with it wherever they live.
Right.
Yeah.